have come out of this briefing was the fact that the doctors now say the president could be discharged from the hospital as early as tomorrow. We also heard some of the president's staff have already been retweeting that and trying to spread that more broadly. But there were also some concerning pieces of information that we learned today, including the fact that there was a second situation where the president's oxygen levels had dropped to a point that was very concerning to his doctors. One of the issues that's really going to come out of this briefing is the fact that the president's medical team is still declining to be fully transparent about the state of his medical condition. Either you're going to be transparent and you're going to tell people what the situation is, or you're not. Yesterday it was the issue of whether he had been on oxygen. Today they confirmed that he was on oxygen at least once, but they're not disclosing what level his blood oxygen levels actually dropped to. They're kind of dancing around it, saying, well, it didn't drop to the low 80s, it dropped below 93, 94, but they won't really put a number on it. And they're also not willing to disclose what they found on chest scans. Potentially there could be some inflammation of the lungs that they could have seen, given the fact that he has now been prescribed, as the doctor said, a steroid that is often prescribed when you do have that kind of inflammation. They're declining, though, to tell us exactly what was on that, other than to say that it was nothing that they wouldn't have expected. So more questions now about why the doctors are still declining to sort of lay it out on the table, even as they're providing some of this information. But again, some good news for the president's health, that his doctors say it's possible he could be discharged and returned back to the White House to continue to convalesce as early as tomorrow.
Yeah. Hey, Josh, we mentioned it. Let's get to the